session here. Here we'll discuss about some physiological changes occurring during pregnancy. So let's start it. Physiological changes that occur during pregnancy are mainly due to the maternal adaptation to increasing demands of growing fetus. Okay, here we'll take firstly the genital organ changes. So start with vulva. It become more edematous, more vascular, and the minora become more pigmented and hypertrophy. Hypertrophy means the size of the cells will increase. Okay, and just opposite of just similar to that hypertrophy and hyperplasia. Hypertrophy is increasing in the size and hyperplasia is increase in the number of cells. You can remember this by S is near to T. So increasing size is hypertrophy and thus opposite of that is plasia is increase in the number of cells. Vagina. Vagina become more hypertrophied, edematous and vascular, and length of anterior vaginal wall increases. And in this, the most important sign, Chadwick's sign or Jacquemer sign can be seen. This is a dusky hue of vaginal wall seen during 8th week of pregnancy, mainly due to increasing vascularity to the vaginal walls. And the most common vaginitis during pregnancy is candidiasis, because at the time of pregnancy, the pH of the vagina becomes less. It is around 4.5, and candida is able to survive in that type of and low pH and acidic pH. So the most common vaginitis during pregnancy is candidiasis, and the secretion, vaginal secretion during pregnancy is thin, copious, curdy white, and with a pH acidic, and this is due to conversion of glycogen into lactic acid by Lactobacillus acidophilus. Okay, so coming to the diagram of Chadwick sign and Jacquemer sign. Here you can see this is the leukorrhea. This is the leukorrhea, and this purple hue, the purplish discoloration of the vagina is known as Chadwick sign or Jacquemer sign, seen during the 8th week of pregnancy. Vaginal wall become hypertrophied, edematous, and more vascular as discussed. Increased blood supply of the venous plexus surrounding the vaginal walls, and the length of anterior vaginal wall is increased during pregnancy. Secretion is copious, thin, and curdy white, and the pH become acidic. It is around 4.5 mainly, and the most common vaginitis occurring during pregnancy is candidiasis. So, taking the next slide, cytology during the time of pregnancy of vagina. You can observe under the microscope intermediate and navicular cells with a dirty smear. Intermediate cells are basophilic cells with vesicular nuclei. Here you can see this basophilic cells with vesicular nuclei, and the smear look quite dirty. So you will observe intermediate and navicular cells and with a dirty smear. Now coming to uterus. Uterus is enlarged during pregnancy. It is affected by following factors. First of all, change in the muscle up to 12 weeks. Up to 12 weeks, the changes in muscle is under the influence of the hormones, the estrogen and progesterone, which leads to hypertrophy and hyperplasia. Hypertrophy increase in the size of cell and hyperplasia increase in the number of cells in the uterus in endometrium. Beyond 20 weeks, there is a stretching of the uterus due to distension of the growing fetus. It will increase the size of muscles here. Arrangement of muscle fiber is in the three distinct layer of muscle fiber. First of all, outer longitudinal, intermediate, and inner circular. Outer longitudinal is having the hood-like arrangement. O is represents the hood. Okay, so hood-like arrangement over the fundus area, and some fiber continuous there to the round ligament. As you know, this is a uterus, fallopian tube. Okay, so this is fundus, and here the round ligament is attached. So outer longitudinal is arranged around the fundus in a hood-like fashion, and some fibers continue from here to the round ligament. This is the outer longitudinal layer. Inner circular is very scanty and it forms a sphincter-like arrangement around the internal os. So it will forming the sphincter-like arrangement around the internal os and a tubular orifices. So here it is also present here in a circular fashion, and in between them the intermediate layer is present, which is thickest and the strongest layer, which is arranged in a crisscross manner through which the blood vessels run. In cases of hemorrhage, this layer is very helpful as it is forming the as its arrangement of the fibers is in the crisscross manner and known as living ligature, because it helps in stopping the blood and is stopping the hemorrhage. Uterine artery diameter doubles during the pregnancy, and vasodilatation mainly occurs due to estrogen and progesterone. Blood flow increases by eightfold at 20 weeks of pregnancy, and veins dilated and are valveless. Numerous lymphatic channels open up, and vascular changes more pronounced at the placental site where the placenta is attached. So, the vasodilatation occurs due to estrogen and progesterone. Blood flow increases, veins dilated, and lymphatic channels open. This all help in increasing the blood flow to the uterus. And the shape of uterus also changes. In the non-pregnant female, it is a pear-shaped, and in the pregnant female, it is a globular, then becomes spherical, and then become ovular. So it is globular, spherical, and then it's ovular. Then coming to uterine heights. At the end of first trimester, the uterine height is at this level, and then second trimester is at this level, and in the third trimester it is at the xiphoid process apex. You can say like a xiphoid process apex or its end point. Braxton Hicks contraction. These are very important contraction because in the early weeks of pregnancy, it is spontaneous, it is irregular, and it is infrequent and spasmodic, painless, without any effect on the dilatation of cervix. But near the term, it increases in intensity, frequency, and gives a discomfort to patient, and it merges with a painful uterine contraction. During the Braxton Hicks near the term, it leads to complete closure of uterine veins with the partial occlusion of arteries, which decreases the blood flow towards the fetus and leading to fetal bradycardia, which coincide with the contraction. So fetal bradycardia coincide with the contraction, leading to fetal hypoxia. This fetal hypoxia is a transient fetal hypoxia. Okay, now isthmus. During first trimester, hypertrophies and elongates to 3 times its original length, and it will become softer. So isthmus enlarges 3 times to its original length, and it will become a more softer. Cervix soften. Goodell sign is observed by the 6th week of pregnancy. Pregnant cervix feel like a lip of mouth, and non-pregnant feel like a tip of nose. This is a Goodell sign describing the softness of cervix. Pregnant cervix feel like a lip of mouth, like lips, and like a tip of nose. Non-pregnant cervix feel. No, a normal cervix is like this, while pregnant cervix is like this. Here it become hypertrophied and more softened, and this is a mucus plug observed in the pregnant cervix. Increased estrogen increases the proliferation of the columnar epithelium, and columnar epithelium then comes out of external os, and this is known as cervical erosion or erosion of cervix. The question may be asked here, what is cervical erosion or eversion of cervix? It is due to increased estrogen during pregnancy, which will lead to increasing the proliferation of the columnar epithelium, which comes out through the external os and giving the feel like there is eversion of cervix or cervical erosion. Increasing progesterone leads to changes in the cervical mucus. Cervical mucus become thick and the mucus plug is formed, which is released at the time of labor mixed with the blood, and this is known as show. So in the previous diagram, I have shown you the mucus plug, which is due to increased progesterone. Okay, now on drying, the cervical mucus gives a beaded appearance, and amniotic fluid on drying gives a phone-like appearance. So you can differentiate the amniotic fluid or cervical mucus both by each other by their drying appearance. After drying, the cervical mucus gives a beaded appearance, and amniotic fluid gives a phone-like appearance. This is a mucus plug. Ovarian changes in pregnancy, as the alpha subunit of HCG is similar to LH, FSH and also TSH, it will lead to some problems, maybe like hyperthyroidism can be observed if the HCG level become more. HCG level may be high in cases of twin pregnancy, in cases of choriocarcinoma and molar pregnancy. So twin pregnancy, molar pregnancy and choriocarcinoma. And due to this increased HCG level in the pregnancy, in both ovaries, you can observe the multiple theca lutein cysts. Placentamegaly, as the placenta enlarges in size, there is more chances of increasing HCG seen in diabetes and Rh isoimmunization. This will also, in this case, you can also observe multiple theca lutein cysts. Okay. So breast changes evident between 6 to 8 weeks. Montgomery tubercles, modified sebaceous glands. Montgomery tubercles are modified sebaceous gland. They can be observed more prominently during pregnancy, and the secondary areola appears during pregnancy. Colostrum expressed as early as by 12th week. Three things which is less in colostrum compared to breast milk. Rest everything is more in breast milk, which is KFC. KFC is potassium, fat, and carbohydrate. Potassium, fat, and carbohydrates hydrate is less in colostrum compared to the breast milk. Extra calorie requirement during pregnancy is plus 350 kilocalories, and during lactation it is 600 kilocalories. There are multiple times in exam the question is asked, how much calorie is required in a pregnant female or maybe in the lactational stage in the female. So it is plus 350 kilocalories for pregnancy and plus 600 kilocalories for lactation. Gestational age and the changes in the breast volume you can observe, like in the 7th week it is 293 ml, and in the 19 weeks is 381 ml, and 31 weeks is 398 ml. That means the breast volume is increasing with the increasing gestational age. Smoking does not affect the weight gain during pregnancy, but it does not means that smoking is good for health during pregnancy, because it does not affect the weight gain during pregnancy, but it retards the fetal growth, leading to IUGR, intrauterine growth retardation. So, the maximum level of prolactin can be observed during pregnancy. Still, during pregnancy, the milk is not expressed through breast. So, what is the reason behind this? Because increased estrogen and progesterone level suppresses the prolactin. Prolactin has a negative effect on GnRH. So, it decreases LH and FSH, leading to amenorrhea. Drug of choice for increased prolactin in infertile women is bromocriptine. This is important. Which is drug of choice? What is drug of choice for increased prolactin in infertile female is bromocriptine, because bromocriptine is also having the ovulation inducing effect. So it is an ovulation inducing drug. Thus bromocriptine is given for increased prolactin during pregnancy. Common breast changes during pregnancy: sore breast, dark and larger nipples, and growing breast, and leaking colostrum and discharge. Okay, so sore breast, darker and larger nipples, growing breast, leaking colostrum and discharge may be a problem during pregnancy. Thank you.